Thank you, everyone. My name is Nicola Gale, and today I'm presenting on my practicum project with the TestLink Call project with Dr. Sophia Bartlett at the BC CDC. Firstly, we'd just like to acknowledge that the work discussed here today took place in the territories of many distinct First Nations across BC, including the unceded territory and ancestral territory of the Musqueam, Squamish, Tsleil-Waututh, and Stolo nations. I myself am a white settler of English and German ancestry, and I'm calling in today from Treaty 7 territory, colonially known as Calgary, and which is situated in the traditional lands of the Blackfoot Confederacy, Tsuut'ina, Stoney Nakoda, and Métis Nation, Region 3. So firstly, just for a very brief overview of Hep C, it's a very infectious virus that results in a chronic infection for the majority of people. It is also the most prevalent chronic infection in Canada that if left, viral infection in Canada, that if left untreated results in significant morbidity and mortality. Because it is passed blood to blood, transmission is largely driven by injection drug use. And thankfully, there are very effective medications that we have nowadays that can cure chronic Hep C infections. So despite having access to these medications, the populations listed here are just not getting treated. So advocacy groups have called for population-specific strategies to improve health equity for these populations. While many of these identities can intersect, the TLC project is specifically targeting people who use drugs, people who are incarcerated or at risk of criminalization, and including people experiencing unstable housing or houselessness. A key output for this project was a care cascade, which we can see an example of here. Care cascades are quantitative frameworks used to visualize program activities and to identify service and access gaps as participants move between the stages from diagnosis, so the left side of the graph here through to the right as they get blood work done, are prescribed the medications, they get treated, and then ultimately achieve viral cure. So this is provincial data from BC in 2019, and we can see that the largest gap in the care cascade is between the stages of diagnosis to actually starting Hep C treatment, so that box in red. When the 2019 data is stratified between people who inject drugs, so the dark blue lines, and people who do not, or the light blue lines, they found that among people with no history of injection drug use, 73% of those diagnosed started treatment, compared to only 59% of people who use drugs. So quite a large gap in access to treatment. One of the factors identified as a potential driver of this gap in care is digital inclusion or exclusion, which has been called a super social determinant of health. For example, when people are released from custody, folks sometimes don't have a phone, which results in providers not even making referrals for them in the community since they can't be contacted. And this has gotten worse since the pandemic. Online services and telehealth have become more widespread and has helped to make healthcare more accessible for some people, but also a lot more inequitable for others. So that brings us to TLC. TestLink Call is a quality improvement project that's trying to address some of these gaps in access by providing people with a cell phone, support from a peer health mentor, and then support connecting to a community Hep C provider. TLC is sponsored by the BC CDC and is a joint initiative with the organizations listed here, and including Unlocking the Gates, a peer-run organization. So with the TLC service delivery model, the following 3 referral streams can prescribe a cell phone and peer support. So peers can screen clients and connect them to clinics, Hep C clinics themselves, as well as correctional health services. Overall, this evaluation took a mixed methods approach with concurrent quantitative and qualitative analyses. So my practicum project was specifically supporting with the quantitative component and involved receiving data from peer and clinical sites, development of the cascade, and statistical analyses. So overall, I'm helping to help answer the question of what, whereas the qualitative components included semi-structured interviews and helped to answer the how and the why. This is an ongoing quality improvement project, so data collection is happening in installments, and I was looking at the first round of data, so from when the program started accepting referrals in October 2021 to up until last October. So overall, we found 151 clients enrolled, with more than half of those being enrolled by peers. Close to half of participants had no fixed address or were unstably housed, and close to 40% were taking opioid agonist therapy, so methadone or Suboxone. So overall, we interpret this as we are reaching the target populations that we're trying to reach with this program, which is pretty cool. For the overall program care cascade, we can see all participants in the blue bars here. peer enrolled participants in orange, and then clinic enrolled participants in gray. This is a cross-sectional snapshot of everyone involved at this time. And the next step is we wanted to compare to the metrics from the evaluation data from 2019, just to compare the percentage of people who started treatment. So we found that 81% of eligible participants had started treatment, and this is a significant increase compared to the 2019 data, which found that 59% of people had started Hep C treatment. So overall, TLC is significantly increasing Hep C uptake for the overall population, as well as for people who use drugs. From the statistical analyses, we found that participants enrolled by peers had close to 15 times higher odds of reaching the second stage of the cascade compared to clinic enrolled, whereas clinic enrolled participants, interestingly, had 6 times higher odds of having blood work done. So after the first couple stages of the cascade, there was no statistical difference between peers or clinic enrolled participants. And overall, our interpretation of this is that peers are helping to support connection and engagement to care at that front end of the cascade. And then after that point, they're just as likely to support people to start and finish treatment. So I wasn't involved in the qualitative interviews, but I did want to highlight some of that work here today. The care cascade is helpful, but it is only one piece of the puzzle and tends to really decontextualize the experience of people who use drugs and people living with Hep C. And as we all know, that Hep C doesn't just happen in a vacuum, but is a larger symptom of a larger societal context and is worthy of its own presentation and discussion. But I did just want to highlight this one quote from one participant who said, I think that's big in what you guys are doing by offering that device, because it shows that A, you care, and B, there's a treatment out there that's clearly close to 100% effective. It gives people inspiration to follow through, and it's a two-way street. You trust us by giving these phones out before we begin treatment. So that really highlighted one of the themes of the qualitative interviews of enhanced communication and trust with care providers. So right now the data is being merged between quantitative and qualitative evaluation components, but overall is finding that data is congruent between them. And TLC is helping to improve connection to care and addresses multiple barriers that people face in accessing wraparound care. So not just Hep C, but multiple areas of health. It's reaching priority groups, and we hope that this might be a transferable care model for other areas of health like HIV and syphilis. So thank you so much to everyone for listening. I feel very lucky to be in this space with all of you, and a special thanks as well to Dr. Bartlett for her support and kind encouragement throughout this practicum. Thank you to you, Vic, and the profs. And I'd also like to give a special thank you to the many participants of this program, as well as the peers and healthcare providers who really did all the work shown here in connecting people to care. So yeah, thank you so much, everyone.